Dr. Juricek, do you think going to the dentist every 6 months is a conspiracy?
Maybe.
Yeah, let's talk about that on today's version of the Daily Dental Rewind. All right, well, I'm Dr. Smith.
I'm Dr. Juricek.
How was your day today?
It was pretty good.
Yeah?
Yeah.
Were you busy?
Pretty busy, yeah.
I didn't see you like all day.
I know. When we're like passing ships in the night, you know?
I felt like I was going too.
Right. But it's always a good day when you're up to stuff. And
yeah, I feel like it was the hardest I've worked in a while. Y'all kept me busy. But did a couple of onlays. I was going to mention, so most of you probably don't know what an onlay is, and it kind of gets into the nitty gritty of like, how much do we cover of your tooth? But I do a lot of them because I like how conservative they are for the tooth, because if you think about a traditional crown, crowns have to go all the way around the tooth, so you have to reduce a lot of the tooth. Whereas with an onlay, in our CEREC equipment, it allows us to prep only really what that's weakened on the tooth.
You keep the good stuff.
You keep the good stuff. Yeah. And then with a CEREC equipment, we're able to scan that tooth and create a puzzle piece of porcelain that goes right back over whatever area that we're covering or needing to secure.
Right.
But it leaves a lot more tooth intact. So anyways, one of the nice benefits of modern technology, I guess.
Absolutely. Yeah.
But did several of those today. It was like the same tooth number and same restoration. I was kind of like, man, deja vu.
Right.
Well, back to the question. Is going to the dentist every 6 months a conspiracy? I had a patient, actually, he's a new patient to our practice today, ask that. Kind of mentioned that's kind of one of the reasons he hadn't been in a long time, is he just kind of always felt like it was kind of put on,
Right.
And I've had this question come up before. So before I give you my thoughts, what are your thoughts on that?
I don't know if I would necessarily use the word conspiracy. I think I'd use, misconception, because I don't think it's, some major ploy that dentists are just trying to sucker you in.
Yeah, I think it was insurance driven.
Exactly, yeah.
That came up
and
from
that's
insurance
what
a
a lot of people
ago.
don't understand. It's really insurance driven. So it's not even more so us saying you have to come every 6 months. It's
like the chicken or the egg. Like, who really bought in first?
Right.
And I think that, well, if we want to learn a tip, insurance doesn't want to pay for anything they don't have to pay for. We all know that. And I think that the willingness to often pay for hygiene checkups and cleanings is only a tip of the hat to the idea that its prevention is cheaper. And therefore insurance is trying to pay for all the prevention they can,
right,
to an extent, so they can actually get by not having to pay for as much of the crowns and implants and bigger things that they have to cover these days. That's if they did, but they try. So that's okay. My 2 cents. I don't think everybody. The shocker. Get ready. I don't think everybody has to go to the dentist every 6 months. I don't think a lot of you know who you are, though, in terms of like, can you get by? I think a lot of people think they can. Until they call us with an emergency and find out they've got several issues.
Right.
So I think it's really wise to be visiting and getting things checked up quicker, because the smaller and the quicker, issues can be found and addressed, the cheaper it is every time.
Right.
And so I just think it makes more sense. But there's so many factors that we can go into in later discussions, like saliva, pH, balance of your mouth, your diet, what kind of foods and liquids do you eat, your overall health, do you have dry mouth, do you take a lot of medications that cause that?
Yeah.
Are you mouth breathing, like you just said? So there's multiple things I think that can relate to how well your mouth can do on its own. I've got family members that don't live in state, but they haven't been to the dentist in like 10 years. And when I do see them, their teeth look fine and they look healthy and they stay clean. And you can tell a lot of people put more effort into it at home than others, of course. But overall, I think it's really wise. I think the most affordable way of taking care of your smile and the most affordable version of dentistry is prevention dentistry. So if you are visiting your doctor every 6 months, you're going to get more out of that, in my opinion, for the cost than trying to just wait until things break down, because usually it's more costly, it's more permanent, and it's hard. You're just left with fewer options.
Right. And I think if your dentist tells you you need to come more often, it's not anything that you're necessarily doing wrong. It's not a punishment. It's what we just said. There's so many factors that go into it, and you just may need to get your teeth cleaned more often, which that's just the way of the world. That's just the way it is sometimes. Yeah. But
I don't have a hard time keeping weight off. It's genetic in a sense. Other people want to slap me for even saying that. And so that's my predisposition per se. And what a lot of people don't know is that like their saliva consistency can be a genetic predisposition. Some is more watery, some is more thick and better at trapping bacteria and wishing it away or washing it away. So, I mean, that's just one of so many factors.
There's so many factors.
We need to do a podcast about that and talk about that. But anyhow, that's the summary for the Daily Dental Rewind. No, I don't think it's conspiracy. Yes, I think it's wise. You would agree.
Yeah.
But, your health, do what you like.
See us, though.
That was our day in a nutshell. It was a good day. Hope you guys had a wonderful day as well. We'll see you on the next episode.
See ya.
The Daily Dental Rewind. Oh, yeah, don't forget to, click and subscribe.
Like and subscribe.
Do it now. Catch y'all later.
Bye.